following segment is sponsored by Intermountain Health. Today we are discussing a critical issue affecting Utah families: sudden unexplained infant deaths. Dr. Neal Davis is a pediatrician and the Senior Medical Director of Pediatrics for Intermountain Health. He is here to share how parents can protect their babies. Dr. Davis, welcome to the show.
Thanks, good to be here.
This is such a hard topic, but it is one that we need to talk about. Can you explain what sudden unexplained infant death is and how it differs from, the older term most of us know, SIDS?
Yeah, SIDS, Sudden Infant Death Syndrome, is the former term. Sudden Unexplained Infant Death is a little better term because honestly we don't know always why it happens. We know most of the time sudden unexplained infant death is related to sleep.
Okay, so what does Utah's recent data reveal about the main causes and risk factors of sleep-related infant deaths?
Yeah, we're very fortunate that the Department of Health and Human Services has put a lot of work into this. So they looked at data from 2019 to 2023, and the main cause of sudden unexplained infant death is correlated with sleep. So things like having fluffy blankets or stuffed animals or pillows or bumpers in a bedding area, or sleeping in a bed with a parent, or not a child bed, those things are associated with this, though sometimes we don't know why it happens.
So when I had my baby, everyone was saying that it was so important to have him sleep on his back. Why is that so important for safety?
Yeah, overall the risk of sudden unexplained infant death is low. However, you can reduce that risk a lot by putting a baby on their back on a firm, flat surface. On the stomach has higher risk.
Okay, so how do social factors like poverty, premature birth, tobacco exposure, how does that increase the risk of SUID?
Well, you are right. Those things increase the risk. How they increase the risk is a little unclear.
Okay.
But things like passive smoke exposure in the home, prematurity, essentially really stressed house environment can increase that risk.
So we've talked about, all the risks that can increase it. What safe sleep tips do you have to help parents protect their infants?
Yeah, it's best for a little one to be in their own sleep environment, a bassinet or a crib that's made for an infant with a flat, firm surface, and to be in the same room as parents until about 6 months of age at least.
Okay.
And not to be in a bed with a parent at least until 12 months old. So own sleeping environment, flat, firm surface on their back. No fluffy blankets, no pillows, no stuffed animals, no bumpers.
And like we said, it's a hard topic to talk about, but there are tips and there are things you can do to help prevent this.
Yes, and it's interesting that in our state we have about, on average, 27 little ones a year die from this. When I saw that number, it really surprised me. And it hurts because I know families that have had this happen. It's hard.
It is, as a mama of a little baby, it's really heartbreaking, but thank you for coming in, talking to us about this, helping parents know what they can do and what to look for. For more information, you can check out the website at the bottom of the screen. Thank you again, Dr. Davis.
Sure, good to be here.